Last high five so we can start. Okay, a very warm welcome to this afternoon's session. It's going to be exciting. We're going to speak about voices and partnerships to advance health, innovation, and equity. My name is Eva Nathansson. I work at Unitaid. And at Unitaid, we ensure that the best health products are available, accessible, and affordable to the people that need them the most. And I'm happy to be here with colleagues, including Itumeleng Tumi Komanyane, taking the photos here, Jess Burry, and Gamu Guasa. So big applause. So as you can see, we have an extraordinary lineup of speakers today. And what we are going to do is that we're going to highlight how multi-generational voices are shaping the future of Africa's health response. And we have brought together adolescents, youth, mid-career professionals, and senior leaders to discuss and bridge generation divide, facilitate mutual learning, and strengthen decision-making informed by diverse lived experience. That was a complicated sentence. So I guess also our dear panelists, you can also choose, are you a youth? Are you an adolescent? Are you mid-career, or are you really senior? So our aim is to amplify community perspectives on health access and innovation, to foster intergenerational dialogue, to highlight Unitaid's and partners' role in expanding equitable access to better health products and also community-led innovations. We're also going to talk about how we can strengthen cross-sectorial partnerships, and we're also going to talk about how we can ensure that community systems and community-led actions are financed and sustained. So we have 45 minutes. It's going to pass very quickly. We will have opening remarks. We will have a panel. Tumi has promised me to do some concluding remarks, and then we will wrap up. So I have told Priscilla, who will open up, that she has 8 minutes and the others have 4. If you go beyond, I'll be really nervous, and then the AfroCab fan will come up like this. So that's the sign, okay? Very good. So let me present the people on the stage. We have Priscilla Ama Adu, a youth leader from Ghana. Woohoo! We heard her at the ICASA opening, so I think this one should be an easy one for you. A little bit less people. We have with us as well Sidiwe Gaika. Sidiwe is a champion advocate from APA in South Africa. And we have Kimberly Green from PATH. She leads PATH's primary healthcare work. Quite impressive. We have Tinashe Rufur-Wadsu from Weave Healthcare Positive Action, originally from Zimbabwe. And we have Alan Maleche, the executive director from Kelin, joining us all the way from Kenya. So, colleagues and friends, let's get started. And I'm very pleased to welcome Priscilla up to the podium.
Thank you very much, Eva. Thank you all for being here today. The numbers have been reducing every single day, but it is still really nice to see that there are people who are interested in this topic, in advancing health equity through innovation. My opening remarks is going to be very short, and I hope this helps us to understand the conversation today. Across Africa, the history of the AIDS response has been shaped by the courage and leadership of communities. And this year, we have really seen communities stand the test of funding costs, of criminalizing laws, and every major shift that has come our way today, we have adapted. But resilience has consistently been a word that has been thrown to us, that communities are resilient. But that doesn't mean that we should accept less, or we should accept situations that demean us as people. We are still people who deserve the best access to healthcare and innovation. We are going to talk about how we can do this through intergenerational advocacy. And we see that in the faces of shrinking funding and persistent inequalities, there is a powerful wave of new tools. We are hearing phenomenal prevention methods that are going to make life easier. Amazing work in HIV cure. These are all amazing technologies, and we cannot just have them happen at a level where communities are not at the center of these conversations. It is very important that we see the scale up of these to every aspect of communities, to every aspect of the world, that they reach the people who need it the most. Innovation is very powerful. It drives systems. We are investing in innovations at the end of the day. But if we are not looking at people, if we do not have people at the center, then how will these innovations get to them? Essentially, they will just sit at the warehouses and not get to people. This is where intergenerational advocacy comes in. This is where it matters. Senior leaders hold institutional memory and policy experience needed to navigate the complex markets and regulatory pathways. Then we have the mid-career professionals who bring the professional and operational expertise required to translate these innovations into service delivery and ensuring that it gets to the end users. Then we young people bring in creativity, urgency, digital fluency, and a deep understanding of the barriers faced by those who continue to remain unreached. These are all different strengths. Each generation possesses a level of different strengths that we come together with these strengths, we can build systems that are responsive, that are resilient, and ready for the future. The gaps are many, clearly. Integration comes with a lot of gaps as well. And so it is very important that we look at how we can strengthen partnerships and sustain funding for community systems. The cuts will the cuts always affect communities first, and that is the sad reality. But how do we shift from this? How do we mitigate this? With a united movement, the values every generation brings contributes to that. I would want my senior professionals and mid-career professionals not to feel threatened by the exuberance of young people. Each generation possesses a different kind of strength that we can work together on. So as we begin this session, I invite us to think boldly and not to feel threatened. Systems can deliver new technologies if we work together, and the future of Africa and the world depends on us to choose what we want to do together and how we can do that. So I thank you all for being here, and let's hold powerful discussions. Thank you.
So one more clap for Priscilla. I think she's worth it. Thank you so much. And I am really relieved because we also have Violetta with us. Because Violetta, you are actually representing the senior leader in advocacy and activism. I think you all know Violetta. Currently, she works for the World Council of Churches, and we have been blessed at Unitaid because Violetta has been working with us many years to support our community delegation to our board. So thanks for coming. So now we will start with our discussion. So I'm going to start with Siviwe, and I'd like to turn to you for your insights on youth leadership in rolling out health technologies. From your experience with youth-driven introductions, that we now have LEND, for example, that everyone is hoping for, what design choices make the uptake stick for young people? And what can governments do to replicate that success? Over to you, Siviwe.
Thank you so much for your question. Good afternoon, everyone. So to answer your question, I think the answer is within the question. The best design choice to make uptake stick is youth-driven. introductions. When we as young people co-design, when we as young people lead with the government, lead with the funders, it's easy for us to think for ourselves and not have people assume what we want, assume what we would like the introductions to look like. But we should be included from the research to the rollout. So that's to answer the first question. And then to answer how, or rather, what should governments do to replicate the process? The governments should fund youth-led movements. The governments should fund the communities. The governments should fund ideas and not just take us as beneficiaries of the products or just accept us for, for consultations. We're more than just people to consult when you now want to introduce the product. We're more than people that you want to have in the room just to tick the box. So the government should fund this.
Thank you very much, Sivive, for pointing out how important it is that you are there along the road. Violetta, we will turn to you now when we have heard from the youth to hear a bit more on where it all began, the foundation of health advocacy and innovation in addressing the barriers to access. So learning from your past, which approaches are the best to protect the services, even when funding is tight and our civic space is shrinking? Over to you, Violetta.
Okay, thank you so much. I'm so sorry for coming late. I was stopped by so many persons that I needed to talk, but I'm here now. So where did this movement start? I think there are many people who live with HIV for a long time. I'm living with HIV 25 years. And when I started this journey, already there was a lot of work, particularly from the gay community, that were very organized in the US and also in Europe. And they started asking, why would it be so, why it was not okay to just let this epidemic go among the gay men at that time. And this was very inspirational because it changed such a government like the US. And we also had like so many colleagues in Latin America coming from the gay community that helped us develop these petitions to the Inter-American Human Rights Commission, where we were demanding access to treatment, country by country. Honduras, Peru, Guatemala, my own country, we won the cases legally for access to treatment. When we won that emergency response, we then focus on the law, the regulatory framework to make those gains something sustainable. So it was not just a medication because many were dying, but the legal assurance that was going to be there. We managed to get the laws, and then we started fighting for the budget, which I think is the main fight that we continue to do now. How do we ensure this is in the budget, which is not dependent of the international cooperation? I think when the international cooperation came, unfortunately, we got distracted. Remember, the HIV movement was like a big punch. Everything we would ask, we would get, because we were united, we were focused, we knew what we wanted. We wanted life, we wanted justice, we wanted respect. When we started implementing the projects, I think we got distracted in filling these reports, doing the administrative work. I don't know what. We started fighting each other for little money, sometimes so little that it was not worth. I wrote an article, but I didn't publish it. It was called Activist on Sale, because some people would sell the dream for a very small amount. And I think that was not good, because we started getting distracted in this, and we lost the ideology. We lost the goal. I compare it to what happened in Latin America, in my country, Bolivia. We were colonized by Spain, and we say that they came offering these things, these things that look like gold, but they are nothing. And people gave them gold in exchange, silver, etc. So this is maybe what happened. It was not intended, I think, but we should have approached the management of the resources with more wisdom so that we would never give up on the goal of universal access to prevention and care. Now we are faced by force to respond to this question. So what are we doing to secure this legacy, to ensure these gains are still there? I'm so glad the young person started, because I've seen in many of our colleagues in my generation, there is not so much will to integrate the young people, because there is the fear, you know, they will invite them and not me to the meeting. So what about some funding? And sometimes I had to find colleagues saying, you must bring the young people, no matter if they are the next ones to be in the podium and not us. This is important. We must pass the strategies, because we might get sick at any time, not be able to be in the discussions. This is also part of the sustainability, you know, sharing our experiences, sharing our strategies. So this is maybe what is missing now. And for that, I think this table is very important, that we generate an intergenerational dialogue amongst ourselves and putting our focus on the funding. Because we can have a lot of solidarity, we can have a lot of stigma reduction, but if we don't have the funding, it's like nothing. So now we should say, okay, give us the policies to reduce the stigma, this is okay, but also give us the money in the budget for HIV prevention and care.
Thank you, Violetta. I think that was a beautiful opening by both the senior leader and a youth champion to talk about how important it is now to work together. And I'm sure you are doing that, but a lot of commitment, efforts, advocacy, activism is still needed, certainly. Kimberly, we are moving to you when it comes to service delivery and health system navigation. So the question for you is, what practical redesign in primary health care, we can talk about task shifting, point of care diagnostics, integrated referrals, etc. What of those models do you think are important to cut the diagnosis to treatment journey, especially for marginalized community? And how do you see the way how we can incorporate community feedback loops to sustain such systems?
Thanks so much for that question. I think that's the question of the hour. And I mean, I think that in this year, what's really been underscored is that change, and quite traumatic change, is the constant. It's with us. We're living with it. And what I see from those of us here on the panel, in this room, at this conference, and many other individuals, young and old, is that we see people who are leading and leaning into change, as difficult and as hard as it is. And that requires a lot of very different thinking from the way we operated in the past. And I think that's your recommendation, is embrace young people, embrace very different ways of thinking, and also your idea as well, Violetta, of needing to step aside and in some ways start all over again. But I think what's very clear, and this happened here in Accra with the Accra reset, is that governments are wanting, very importantly, to design primary healthcare services on their own terms. And I think that this is the critical opportunity for community organizations to be essential and at the table as part of those redesign processes. That is probably the most critical discussion that needs to happen. I mean, I think we know, right, that when communities are leading in the design of health services that they want, that they'll come for, that they're part of delivering, that's when you get uptake, and that's when you get the continuation, whether that is through use of digital tools like telemedicine or utilizing AI, if it's task shifting, where young people living with HIV, key populations are delivering the services formally paid by the government, integrated as part of community health workforce and as part of primary healthcare structures. We know that works. So I think this is the critical question, that is the how. How does that happen? And I can see some great examples already of community organizations that are showing up to offer their services and support to governments. I've seen that in also difficult circumstances, like in Uganda and Zambia, where key population organizations have relationships and trusts with the government, key government actors, and are able to have those conversations around what needs to happen now. It's not perfect, and I know there's a lot of challenges. I know a lot of people have been left behind. I know there are a lot of people who have stopped taking their treatment. This is real. And so for governments, I think the call to action is clearly to invest in community groups as part of the healthcare system, as part of how you get to ensuring that people do want to come forward for screening or continuing on their treatment, or to come forward for lenacapavir, and all of the other services that are available or should be available through primary healthcare, whether that's screening for syphilis or if it's to get assessed for hypertension and diabetes. So those would be my main observations and insights. Thanks.
Thank you so much, Kim. I saw a lot of nods from the audience and from the panel. I think we are all speaking the same language here, so thank you so much for those very useful reflections. Tinashe, now we move to you. And we're going to talk about how we can finance and ensure sustainable financing for community systems and responses. In your experience, what are the factors that ensure that the funds really reach the grassroots, the community, and civil society? And how can we ensure that that funding can become sustainable and not only linked to a particular grantee's funding cycle?
Well, that's a very big question, and thank you so much. So before I joined VIV, I used to work for some of the NGOs, and I really also kind of understand some of the challenges that they face. But one of the most important things is that for our program, it was established in the year 1992 as the first pharmaceutical grant-giving program that was actually providing financial support to the communities of people living with, affected by HIV. And at the moment, we are also currently looking at the operationalization of our 10-year strategy, and we're in the year 2025, which is right at the midpoint. But since the year 2020 to the year 2024, we have invested about £65 million into the communities, which I think is something that is great. We're actually kind of focusing on a number of areas, which are ending pediatric AIDS, HIV prevention, harm reduction, as well as stigma. So as we are moving forward into the next phase of our strategy, I think it's also very important for us to look at how can we ensure that we center communities at the forefront of decision making. And it's something that we are also kind of doing as VIV Healthcare Positive Action. We have what we call the Strategic Advisory and Technical Review Committee. This is a group of independent people, experts from a diverse area of backgrounds. There are people living with HIV, people who use drugs, key populations, and they make decisions on what we need to fund and where we need to then kind of invest. So as mentioned before, community leadership is very, very key and important. And to us, money alone is not enough. We also provide capacity strengthening, where we then provide additional financial support to some of our partners. So this is the financial aspect of things. However, within the business, we also have what we call the skills connector. So we have got over 1,000 staff that are also dedicated to ensure that organizations, they get support. It can be development of a policy, development of any other resources that they also need to then operate. And in addition to that, we also have what we call the Allies program. So this is our accompaniment portfolio. We work with also 35 volunteers within the business. They are the day-to-day people that can be conducted by our partners. So you can actually kind of see that to us, we are going an extra mile, and I've worked for NGOs, applied for funding before. I have never been connected to someone that I can reach out to. So it's something that is also great that we do. The other part that I then also want to highlight is that our funding is very long-term, and I will explain why. So we provide financial support for what we call Innovator, and Innovator, we allow our partners to test and pilot some of their interventions. And to me, it's something that is flexible because mostly we get news from funders to say you need something that is backed by the entire evidence, and innovation really sometimes miss on that. But as we do that, and that grant is up to 2 years. We also have what we call the momentum funding, which is also a grant that is there to ensure that we advance existing interventions that can be scaled up, and that is more of a 3-year funding. And on top of that as well, we have got our strategic partnership pillar, and we provide long-term funding for 3 to 5 years. And with this funding, we also work with the regional and the global organization, as well as the multilateral agencies. So I think it's also something that is very key and very, very important. In terms of localization, our partners have been also working with their governments. I know that there are a number of models where they can be supported by their government. And I think one of them is the CATS model, where they also kind of work with the national AIDS councils and also with the ministries of health. And now it has been also scaled up into 15 countries. We also have one of our partners from Nigeria working on key populations, where they also get some of the commodities from their government. So when we talk about how can we allow our governments to then also kind of provide support, I think those are some of the examples that we can also kind of look into. And the last thing is that as we are also moving into the next phase of our piece of work, I think as Positive Action, we are there for the communities, and we will then also continue supporting our partners. So thank you so much, Eva. I hope I've answered you correctly.
Big hand. Thank you, Tinashe. That's very interesting. We'll come back to the questions, I'm sure, on that one. So our final panelist is Alan. And now we are moving in to the perspectives of human rights to access life-saving treatments, tests, preventions. So we would like to hear from you, Alan, with civic space shrinking, what legal or policy change should countries make in the next year to protect community leadership and rights-based approaches?
Thank you for the not so easy question, because in a world where human rights is not being appreciated, in a world where people don't care for other human lives, and in a world where people are putting profits and trade at the head of people's health rights, it's very difficult to know what kind of legal or policy reform you could advise any government to play now to be able to ensure that rights are safeguarded. I think I have come to the resolution that we must first safeguard what we have gained. The fights Violatas talked about in terms of getting access, getting people to be part of representation in various global bodies, as we do have communities, the civil society in Unitaid NGO board, and in other boards like the Global Fund or UNHPCB. I think I subscribe to the school of thought that we definitely must hold the line right now, and hold it in 2 ways. The first way is to ensure whatever progressive laws that we have that allow for community leadership, community participation, we must hold the line through litigation, through advocacy, through constant documentation to ensure that line does not recede backwards, because we may reach a point where we are told the voices of young people, the voices of people living with HIV are no longer needed on these boards. We just have technical people or government-to-government relationships that will solve these issues. That is where we are heading. And so we must hold that line even before we think about creating any law. The second way is to say where they try to pass law or policies that will take away that space, we must push and fight as hard as we can. We know there are 18 countries in Africa that are going into conversations with the US government. Mine has signed as quickly as possible, but we are hoping to set the precedent of what happens when a government signs and it does not listen to its people, so that we can then also guide others to follow our pathway. Thank you. In terms of ensuring voices are not left behind. So I think the answer to the question is basically to say, the difficulty with law is that we can pass all the nice laws, we can pass all the nice policies, but the rubber hits the road around enforcement. And for enforcement to work, we have to invest in groups, young people, mid-level career like myself, more seasoned activists like Violata and Sean seated there, and Lillian and my sister Yvette, who is still young at heart. But we need to think through, how do people know about these laws? How do people know about their rights? Because right now we are not just dealing with health rights, we are dealing with different rights like freedom of association, freedom of speech, access to information. Because if you look at the agreements that are being signed, not being made public, so everyone is blind around what's going on. So we have to think through, as a HIV movement, how do you work with people dealing with civic rights? How do you work with people dealing with political rights? And how do we work with people dealing with freedom of expression? Because we need them to be able to safeguard this space. It's not just about access anymore. There are many other things that the space is shrinking, and we need to find that collaboration, both within movements and both within generations. We want to learn from Violata. How did they go about the issue of access to treatment? How did they win the legal battles? And then we want to learn from my younger sister, how do I use it to make that campaign more interesting? How do I be able to use my legal advocacy in a way that makes sense? And of course, Tinashe rolls the money forward, and then we are able to take this particular work ahead to safeguard the civic space. So in the long and short, that's my answer. And it's not an easy space to be in, but we must hold the line. If there's anything you must do wherever you are, hold that line until we survive this storm.
To me, maybe we should ask Alan to summarize the outcomes then of the meeting. But thank you very much. I mean, it's sad to hear that we need to ensure that what we have is still continues, and that we enforce what we have. And thank you also for making the link to the reality, the global health financing reality, and the global health politics that we are living in today. We have a few minutes left, so we'd love to take some questions from the audience. So please raise your hand, please say your name and where you come from. And we'll have to make sure there are some mics as well. I see Yvette.
I thought you were coming.
Good afternoon. My name is Chief Mrs. Adoni Udu. I'm the MD CEO of Acons Nigeria Limited. I'm from Nigeria. If you want to, if we have NGO and we want to help the community, how do we assess this funding to help the community in terms of understanding what their situation is, and in terms of reduction in infection? And I know there's one thing that has not been discussed since I've been here for this conference, and that is a big headache for Africa, and that is blood banking and blood transfusion. They are very innocent people that go to the hospital. They are not promiscuous, they are not sex workers, but for one reason or the other, maybe through accident, childbearing, anemic situation, or emergency surgeries, they get blood transfusion and they get HIV. So, but that is not part of this, what we're discussing now. But I just want to know how I can reach out to help others, what the funding is all about. Thank you.
Thank you so much. Yvette, please.
Good afternoon, everyone, and thank you so much for attending this session. I'm taking advantage to ask the young people the questions today. So clock it to you guys. I have two questions. Just before I continue, let us please be very cognizant of language when we talk about people living with HIV and how the blood is transfusions and all of that is happening. And I'm referring to my previous speaker. It's the third time she does this. So nobody has said it's unacceptable. Tinashe, as young people, we all know we are in a huge storm of change to what we know, right? And what are young people doing to ensure we don't lose the gains, like Ellen is saying, but also how do we actually protect young people who are doing the work in Africa in a time like this, right? I'm saying that because we all know this time is important for us to keep in mind that young people are going to go through the most with our governments being in charge. But I want you to answer that, especially when it comes to funding. Many of the young people are now going to turn to, ask for funding or request for funding from pharma. How are we going to ensure that there's a clear line in ensuring that we don't promote the narrative that it's big funding these organizations so that they bring the meds in our countries? It's important that we do that and think about just how, because funding is cut and the gap you are taking as pharmaceutical companies, even as ViV, how are you going to deal with that inside our countries? The people's lawyer, are you ready to protect us from the future where clearly our human rights are going to be stripped from us? Our governments are going to sign. I see you getting ready, but how are you as human rights lawyers working together to prepare for this? And how are you going to also prevent weaponizing of activists in this space? We are entering a very dangerous space. I thank you.
Thank you, Yvette. So I think I would like to ask Kimberly maybe to answer the question on how NGOs can mobilize resources for communities and for community needs and actions. And then, Tinashe, you got the privilege of also answering the question how we can protect the young people from doing their work despite influences of private sector and influences of governments that may have very different values from what we do. So first, over to you, Kimberly.
Thanks so much, Ava. And obviously, this is a difficult question, and it's one that many community organizations and larger organizations are facing right now, given the global health funding cuts. But I will say, and I want to give a big shout out to Lillian Mareko and ICWEA. We are co-leading a project with Lillian and her team and the World Hepatitis Alliance that is focused on community-led responses together with government leadership on eliminating vertical transmission of HIV, syphilis, and hepatitis B. And as part of that, there is going to be calls for CBO responses, small grants. So please, she can tell you more, but please keep a lookout for this. There's a number of countries across. Sorry, Lillian, but it's great. It's so wonderful. There'll be fantastic opportunities to engage on increasing awareness and access of essential services as part of primary healthcare and much more. So I really wanted to give a shout out there. And secondly, just to say that as the civic space is shrinking, that it is really important to recognize Unitaid, who is stepping in the opposite direction to increase civic space. And I really want to give a shout out to you because it's not what's happening among, well, I won't name names, but I would say that your leadership is something that I hope is seen by others, just exemplified by what's happened with the booth and the booth takeover by the community and really embracing strong community voices. I think that this panel and who you're partnering with, who you're listening to, and who's shaping your directions with community embedded in the governance board, I think it is exemplified throughout. It's exemplified through you. It's exemplified through the work that we get to do with you. And I will say you're doing hard things. We also have the honor of partnering with you in harm reduction and reaching people who inject and use drugs in partnership with input across many stakeholders, and trying to increase access to long-acting depo-buprenorphine, which I don't know, many of you may not know, but there's a long-acting option for people with opioid substitute dependency, and it's only available in high-income countries. And so through this amazing partnership with Unitaid, the evidence is being generated for WHO recommendation, which will come out in early next year, and is going to open the door for access to this phenomenal product that is already changing lives. So I just want to say, big shout out to you. Sorry to steal the mic for that, but thank you.
No, so Kim, thank you so much for that. I also want to echo that actually our leadership and our executive board and our executive director, they are all very committed and supporting to community and civil society engagement. For the booth, we are so happy, and this was absolutely a joint venture. So really, I think it's such a beautiful experience to share the booth. I think we had so much energy. I haven't seen that for many times with collaboration with so many of you. So it's really a good opportunity to share, to learn, and to get to know each other better. So this will not be the last time. Even Tumi will maybe not be happy to hear that right now. But thank you, Kim, for those wonderful comments. So Tinashe, over to you.
Okay, thank you so much. So I think the first question on youth leadership, I'll try to answer it because I transitioned from youth leadership, and I'll answer this based on my own experience and what I've been actually kind of observing on issues around funding, and how can youth be able to maybe work together so that they don't compete for funding. I think the cuts had actually kind of affected all the people and the young people as well. And we can also agree that when it comes to youth leadership, there's no particular module that as young people go through to learn about leadership. And the only way that they can achieve their youth leadership or maybe strengthen their resource mobilization, their forward thinking, is for them to be able to then identify someone senior or that they admire or a mentor. So I think that is also very key and very, very important. The other response could be, I've been thinking so much on how best can a movement of young people come together collectively, because funding is very limited. And all the young people, they are also coming to then kind of compete for the same funding, maybe from the same country, from the same region. How can we come together as one group, as young people, so that we don't, we do not compete for any funding that might be there? And I think sometimes the more young people we unite in whatever we want to do, each organization will come in with their own niche, maybe consortium. They can be very much helpful to be able to then do that. So I would say that would be my response on that piece of work. On the other aspect of the question, I'm going to respond it in more of my previous experience working with Y Plus Global, where we have had the opportunity to be managing the Hair Voice Fund. So basically, it was a funding targeting adolescent girls and young women, looking into issues around advocacy. And I would say from that piece of work, it was more of the programming for civil society, and there was nothing that had to do with some of the products that maybe the funders might be working on. And as mentioned before by the speaker, more of my work is focused much on the corporate philanthropy. So I'm part of the community, we are the community, and we are there to ensure that we support our community partners to be able to then continue accessing the healthcare that they need. So that would be my response on your question, Auntie Yvette. Thank you so much.
Any other, or are we?
So Am I ready? I've always been ready. I've never stopped being ready to stand for communities, to fight for people who are vulnerable and oppressed. And if it means leaving that legacy, that is what I have to do till the day I go, not 600 until I'm cremated. But safeguarding human rights is something you cannot stop doing. You cannot sit back and say, there's no funding now, it's too oppressive, there's too much injustice, what will happen to me? You just have to continue to fight for what you believe in and try to safeguard those who are truly being pushed to the edge of no return. And even when we talk about the agreements, we're not only talking about the health agreements, there are also trade agreements that are happening that are making data exclusive, that are making access to medicines difficult. And it's also coming from a known quarter, such as the United Arab Emirates signing free trade agreements with our countries that sees their drugs getting more lifeline for their patents and access. So there are attacks all over. And for us to succeed, it's not just about Alan only being the person to defend the vulnerable people, the young people, people living with HIV. It's about how do we think through legal strategies. And it cannot only be won by lawyers, it needs to be won by everyone. We need to understand from the community, we need to work together with journalists, we need to work with healthcare workers, we need the innovation, the strength, and the resilience of young people. And from coming from Kenya and appreciating the effect that the Gen Z movement had in helping us understand how can young people take charge in fighting an oppressive government on taxation issues. I strongly believe this is something we have to do in the health movement, where we get intergenerational dialogues, meetings, conversations, and we don't have to be flown around the world to do this. We can Zoom, we can do Google Meet, but we need to find a way where the younger people appreciate the struggle that went into getting access to treatment, and us younger people at heart but called older need to also appreciate what are the pressing needs, what are the ways young people work, and how can we support them to be able to achieve. So for us to stand the line, for us to weather the storm, it needs solidarity across age groups, across movements, and dedication and sacrifice. There may be no funding, but we can't stop fighting for human rights.
Thank you so much, Alan. We don't have many more minutes left. So Tumi, would you please come up and say a few words, closing remarks, please?
I've never been more glad to see stairs because I was so worried the whole time how I was going to climb up here. I'd like to say thank you so much to the panel and to the audience. This is literally one of the very last sessions for the day, and we appreciate you being here. My task is simple. Well, I don't know, but I'm going to try and make it simple. Priscilla, thank you so much for being with us. You told us that generations possess different strengths and that we can design multi-dimensional responses. You also told us that insights, or rather you gave us insights into youth-centered programming and asked that we think boldly. Siviwe, yours was a journey of why it's important to center young people. You reminded us that young people should be included from research to rollout, and that we need to ensure that in doing so, young people's work is always funded. You remind us that, that young people aren't tokens and that there needs to be accountability in sustaining youth voices and impact. Violetta, yours was an inspirational conversation. You helped us walk down memory lane, reminding us of all the heroes that shaped this work and where we are today. At a time when diversity is under fire, your reflections reminded us that it was diversity that shaped the response. unity, justice, and respect are some of the values you shared. Memoirs like Activists for Sale and many others are possibly the reminders we need to keep to ensure that we don't forget how far we have all come. Kim, you reminded us that, sorry, I'm stuttering my words. You reminded us that when communities lead in the design of health services that they want, that's when uptake truly sticks. While there are a lot of challenges, we need to ensure that we maintain the call to action and that governments need to invest in critical services, especially primary health care. I could not agree more with you. Tinashe, yours was a reminder that when companies invest in community, results become clearer and the return on investment sustains impact. You shared with us innovative mechanisms to fund communities and to do so through an accountability lens. We now know that VIV's response is multi-level and far-reaching. You reminded